Hey, Jamie, how are you?
Good. How is your day going?
It's extremely busy, but it's very bright, as you can see. It's nice, sunny, warm. November 4th. Look at the amount of color on the trees and look at how bright and sunny it is. So, just a happy day, just a good
Or-
day.
Yeah, I would agree. I've myself gone outside just for a little bit of vitamin D.
Excellent. Hey, so kind of a good topic today. Uh, and the topic of having a better life. Wouldn't life be so much better if we didn't have these peaks and valleys of the high sugars and low sugars?
Yeah, I think our patients would really benefit if we can get them off of these peaks and valleys.
Absolutely, and I think the thing is, it's their benefit, less symptoms for also us. It's like getting those calls at unusual hours. My sugar is super high, super low, or visiting in urgent care or things like that. I think so. If we can address these peaks and valleys of diabetes, it's definitely going to be a game changer. And speaking of that, I'm kind of excited about the kind of advancements that are happening in diabetes right now. The For type 2s, there are these newer medications which really bring the peaks down, both the SGLT2s and the GLP-1s, and we'll talk about those at the end. And then for type 1, just the better sensors, better pumps, faster insulin, so that we can have this closed loop or artificial pancreas. So again, we can get these peaks and valleys out of the way. So yeah, I think there's a lot of exciting things happening in this area too.
Well, Dr. B, I don't want to cut you off too much, but it is time for us to actually get into the content, and I don't want you to spoil all the fun surprises for our audience either.
Okay, good point. Well, greetings, everyone. Thank you for being here today for our discussion on the peaks and valleys. So, are you tired of the peaks and valleys of diabetes? Do you feel like your sugars are always on a roller coaster? Do you want more stable blood sugars, better time in range? Well, if you do, the next 30 minutes are going to be game changing for you. And also, if you know of people who need that kind of help, please invite them as well. So, we'll talk today about a few topics. Why should your sugar? Why do your sugars go up, or why do they skyrocket? If we can go to the next slide, please. Um, then, how to prevent the hypoglycemia? It's a very uncomfortable feeling. So, how do we prevent the dreaded treatment of hypoglycemia? And finally, what is this new concept or paradigm, time in range? And how do we maximize the time in this time in range? So those are the things we'll talk about today. Let me just introduce myself. I'm Dr. Bhargava. You can also call me Dr. B. I'm an endocrinologist. For last 25 years, I've been very interested in diabetes and how we can change diabetes. So I do a lot of clinical research, more than 100 diabetes trials. I have a website or platform for patients, and we have an innovative clinic where we can take care of patients with diabetes who are not able to find help elsewhere. The To help with this conversation today, I'm not going to be doing it alone. We'll also have Jamie Pitlick with us. Jamie Pitlick is a pharmacist, associate professor at Drake, and super passionate and knowledgeable about diabetes. So, Jamie, welcome to the conversation. Excited to have you here.
Yeah, I'm always excited to join in conversations about diabetes. I could talk about things all day long. Um, I am super excited. I've got a couple of reminders for patients. Just we want to interact with you. We want to hear from you. So we want to reward the person who is the best diabetes detective, meaning the more you talk with us, the more intriguing questions you ask, you could actually get rewarded with a $5 Amazon gift card. In addition, we've got a very exciting offer that can get you in to see us at one of those intriguing clinic visits that Dr. Bhargava was saying. You can actually experience some of the care that we're providing here at Iowa Diabetes Care. So it comes with a courtesy visit, which is a $150 value for you guys. And for more information about our clinic, you guys can visit us at iowadiabetes.com/care. So super excited for you guys to look more into that. Before we get started into the actual content in our conversation, we have a question for you guys. How satisfied are you with the fluctuations of your blood sugars? Not satisfied, somewhat satisfied, or very satisfied? Put them in the comments. Let us know how you're feeling, and then we can actually interact with you guys and help you out.
Excellent. All right. So, great question. Are you satisfied or not? I see one of somewhat satisfied. And I'll tell you my story on this. My story is I was at the national meeting, American Diabetes Association, and there were several booths. So, one booth was serving smoothies. And then a few booths down, there was somebody who was checking sugar. So, I had a smoothie. And without really thinking about it, I went to get my sugar checked. And it turns out it was 160, and I don't have diabetes. So for me, that was kind of a peak. So Eugene, you're not satisfied at all. So we definitely will talk about this a lot today and see how we can reduce. Jenny says the same thing, not satisfied. And we understand that. And we see this every day in our practice. We get these phone calls, sugar's too high, too low. And this has a major impact on your quality of life. Apart from health and complications, it's also the quality of life. So thank you for sharing that. We know it's a real problem, and that's why we wanted to discuss that today.
And I just want to point out that you guys aren't alone. So we have two already saying that they're not satisfied at all. You guys are not alone out there. There's hundreds of patients, thousands of patients dealing with this and are on the same roller coaster that you guys are on.
All right, so let's break it up into three pieces: highs, lows, and then the middle, time and range. So let me share some information. Jamie, should I be sharing my slides or?
I've
Yeah, I
got it
can.
pulled up, or if
Okay.
you've got it, great.
No, that's fine. Go ahead. Let's think about target blood sugar. What's the healthy middle? And when we think of it, it's about 70 to 180. In general, if you are above 180, we kind of deem that as high. And there's a color coding to us, like in our platform also. We use green for in range, orange for high, and red for low. If you are below 70, in general, that will be deemed low. Now, please do know that some normal people do go below 70 just as part of being, having ups and downs of their sugar with eating food and so forth. Even a normal person wouldn't have time in range that is 100%. Nobody does. 90% is probably where I stand without diabetes. So now let's look at what do the organizations say? What should be our target range? So the American Diabetes Association has one guideline. My association, the Endocrinology Association, has another one. And I think these are good. And yeah, for the after meal, they have a difference in when it should be checked. So let me just give you how I simplify it. I call it the 80 plus 40 plus 40. So sorry about that. Um, all right. So 80 to 120 before your meals. So that's the 80 plus 40, 80 to 120 before your meals. And then another 40 for after meals, meaning 160. So 2 hours after a meal, if you are below 160, that's good. So that's how I just keep it very simple. 80 to 120 and then up to 160.
Yeah, I think that's a really simple way of putting it.
All right. I was trying to change my slides, knowing that, not realizing that it's you. And maybe I should share my slides.
And,
Allow me, please, to just share myself.
and we've got we've got some other comments. We've got Kathy who's chiming in saying that she's somewhat satisfied, but when she's trying to keep real tight control, she really runs the risk of getting low.
Okay.
And so she can be frustrated with that.
Agreed. I think that's definitely where is the right balance, and I think we will talk a little bit about that in a moment. As what is the right balance? I think perfection is not the goal. Can we get your sugars in range without too much burden on you? That's really what we want to go after. An acceptable time in range without too much burden. So thank you, Kathy, for that comment. All right. So let's jump into the high sugars, the skyrocketing sugars, and the common causes. As we were writing this list, there's many, many different ones. And if you have other ones that affect your sugars, please chime in as well. But here are some of the common causes. Just eating simple sugars, they'll take your sugars rapidly. If you have a more complex meal, that's much better for you. If you add some protein to your food, sugars will not skyrocket. But if you have that donut or cake, or for that matter, even simple fruits, they can raise your sugar. So, and I want to talk about why it happens and what we can do about it at the same time, right? So, first of all, consuming too many simple sugars. One of the things to remember then is you have to have sugars and carbohydrates. You cannot live without them. And we don't talk about extreme diets, but think about 45 to 60 grams of carb with each meal and distribute them through the day. If you have a really large amount of sugars, like get one of those smoothies I was talking about from McDonald's or something, your sugars are going to skyrocket. So think about how you can limit and distribute your sugars. Another reason, sickness. And by the way, Jamie, chime in wherever you want on any of these as well. So if you are ill, there are a number of things that happen in your body. All these hormones go up, you're not as active, the infection or something may be there. So when you get sick, your sugars go high. And I believe we did a webinar very recently on this. So please feel free to attend. For this one, you get a special session on what to do when your sugars are high and you are sick. So our team will share that.
Yeah,
Jamie, go ahead.
I was going to highlight that video is there from 2 weeks ago. And Doug is saying that he's having a lot of problems because he's sick right now as well. So Doug, I highly recommend that you take a look at that video that we had 2 weeks ago. We explicitly talk about what to do when you're sick and have those high blood sugars.
Yeah. All right. Thank you, Doug, and hope you feel better. We got to take charge of our diabetes and our disease together. So yes, all the best. The next one is skipping medications. And this is an important one. So, for example, especially people on insulin, right? If you have a meal, and I'll show you some examples of this later on, and if you don't take your mealtime insulin, your sugars will skyrocket too. If you skipped a medication or two, your diabetes pills, that can have an effect also. So definitely take your medications. Now, this is something Jamie is very passionate about. She's a pharmacist. Anytime you guys need help, she can do a medication review for you. At the bottom of the screen, there's a survey, and we'll share it in our feed also. If you want to get your medication reviewed or know if any of the medications are leading to high sugars, please fill that survey out. There are many medications. Steroids are probably the best example. So the prednisone, dexamethasone, you take in pills for poison ivy or for another disease. You get a shot of steroid in, like my shoulder has been hurting. So if I get a shot, sugars may go up. So steroids are a culprit, but there's so many other medications that can lead to high sugars. So again, for these, you can fill the survey, you can get a medication review. Jamie, do you want to add anything on that front?
No, I'd be more than willing. If you fill out that survey, we will definitely give you a form that's got the most common culprits of medications that cause blood sugars to increase. Steroids are the number one. I mean, you talked about injections. You can also use creams. And if your dose is high enough in the cream, that can still affect your sugar. So I can talk through all of those with you guys and happy to do that. So just fill out that form and I'll give you guys a call. I do want to go back to the simple sugars. Kathy has a question.
Yeah.
About how to adjust your insulin when you're eating simple sugars so that you don't get high blood sugars.
Right. So I assume Kathy is on mealtime insulin. And the way many people start mealtime insulin is, hey, take 6 units with breakfast, 8 units with lunch, and so forth. But eventually they move into carb counting, where you say, hey, a cup of milk has 15 grams of carb. My banana has 27 grams of carbohydrates. This bread has another 14 grams. So I'm eating, let's say, 60 grams. Your doctor would give you a ratio, and it's very common for us, standard of care for type 1 and many type 2, to give you a ratio. Hey, let's say your ratio, Kathy, is 1 for 15 grams. So for 60 grams, you'll take 4 units. But another day, if you ate much less or much more, you can dose it up and down.
And it looks like she's just responded and says that she does do some of the carb counting.
Sure. And please know that it's very inaccurate. It's not easy. You just keep doing it, keep learning and making it better and better. That's what you got to do. It is.
Yeah, I was going to add, what you'll see is there's different foods that are going to trigger you just a little bit different. So
Sure.
a simple cookie might be different than pancakes, and it all just depends. So keeping track of that and how much insulin you took one day versus to see how your blood sugar reacted, you're going to learn which foods spike you more.
Got it. Thank you. The last thing I would say is stress. Stress, and these days are high stress for many, many people. So stress also can increase sugars. Then you got to adjust your medication. You also got to think about how do you relieve stress? Being outdoors, being with nature, doing yoga, meditation, exercise. These are the things you want to think about for sure.
Uh,
So, yeah, go ahead, Jamie.
Kathy's asking another question, and
Sure.
so would you take more insulin to cover simple sugars, or do we treat all carbohydrates, I guess, the same?
Okay, great question. So I think in general, because it's such an imprecise um, science on this, the math, that in general we don't go into further than just counting carbs, but it does make sense. Simple sugars are going to spike faster for you. You may want to dose 20 minutes early instead of 10 minutes, for example. And you just have to be careful on that. Your sugar has to be reasonable to do that. You can bring the dose just a little bit further. In general, I say, Kathy, add a protein, add something else to your sugar. It will slow down the absorption. In general, I would not recommend dosing higher for simple sugars. Just do the math, right? But if you know your body and you say that anytime I eat pasta, this happens. I know it's 75 grams, but my sugars always spike up and I don't go low later on. Then you can dose more for it. So use your own body's response and reaction to address that.
The other thing that I would add is, Dr. B, do you think there's any medicines that, especially for somebody who's on mealtime insulin, might better cover a simple sugar, like some of those newer insulins?
Well, I think so. When we think of the peaks after meals, there are some medication that are really good at getting the peaks down. These medicines, the SGLT2 inhibitors, get the sugar out in the urine. They work both on fasting as well as post-meal sugars. So that's a medication class. Another class that might help is the injections called GLP-1. And these include like Victoza and Trulicity and Bydureon and Ozempic, etc. They do a really good job of bringing the sugars down after the meal by slowing the emptying of the stomach, getting the pancreas ready earlier, and so forth. So those are some medications that have a preferential effect. There's at least two other medications that have that impact, but I want to keep it simple. So not going into the details of some of the less commonly used medications.
Yeah. And then before we kind of go on, we've got Randy's question out there.
Sure.
And give us he's on Tresiba and Novolog, and he's saying he's on some good doses, but he's never in range. And so he's wondering some next steps to take, I guess.
So I think some of the simple things. Are you dosed right on your Tresiba versus Novolog? In general, your long acting should be no more than one half of the total. Many times that's off. So one third to one half. Are your correction factor and your your insulin to carb ratio correct? Do you use a sensor that can give you some data? Your doctor can use a professional sensor and get some data and see what's happening. So I think without knowing specifics, it would be hard. These are great insulins. And by the way, if you are type 1, we probably have a really nice study going on for type 1s on Tresiba as well. And you can find out about our studies at our website, iowadiabetes.com. So I think there are a number of things that can be done. The fine tuning is a process that takes a while. So again, talk to your doctor about getting a sensor. And we'll talk about that in a minute as well. And again, you can see us at Iowa Diabetes Care as well.
Yeah, I definitely agree. And I think it's also looking, like you said, looking at what you're eating, looking at some of your activity levels and making sure that they're all balanced out.
Yep. Well, again, great conversations, great questions. This is great. This is the kind of interaction we want. We want to provide you value, and that value only comes from you asking your questions. So, absolutely delighted. So, let's talk about how to bring the sugars down. We talked about causes and how to prevent the causes, right? But in general, what do I do when my sugar is high? Well, if you are on insulin, that's a little bit easier. Then many of you will have the correction scale with your short-acting insulin, not with the Tresiba and the Degludec and the Levemir or Lentis, but with your Novolog, Humalog, Aspart, Lumjev, and uh, Fiasp. With those, you have a correction scale, so you can use that. Follow your doctor's guidance. We do not provide any medical advice here. Follow the scale they gave you. Don't do it more frequently than about every 3 hours. I mean, you could stack your insulin and go low. So keep that in mind. Drink plenty of water. Don't eat as much. Be more active. Exercise. If your sugars are high and you're type 1, then you may want to check ketones as well, because that may mean that you need a little bit more help and extra insulin. So those are high sugars. That's one part. Now, from peaks, let's go to the valleys. And on this journey of peaks and valleys, I stop here. Jamie will guide you through the valley.
Yeah.
Jamie, to you.
Yeah, before doing that, we've got some more questions and comments. So
Sure.
Kathy is actually commenting that she's type 1 and she's on Tresiba and is interested in that study, I think, that you were talking about. What phone number can she call, Dr. Bhargava?
Our main office number is 329-6800. And then there's the best thing I would say is to go to our website and just fill out a form there. But yeah, the phone number will work too. So Casey, if you can give the number and the show, I'll show the website later on as well. So happy to take care of you. There's a specific phone number for research. Yeah, I think Casey actually gave you the right number. Hey, she did better.
Okay. Good job, Casey.
Right.
And then we've got another comment from Kathleen.
Sure.
And so she says that she is having problems overeating. When she's on her food plan, her blood sugars are actually perfect. And she's on insulin 45 units in the morning and 45 units at night. It looks like it's Tresiba, potentially. But I'm not. No, it's Basaglar.
Okay, so I think in general, she's talking about the relationship she has with food. And I have a complex relationship with food as well, Kathleen. So I see this. I think few of the things you think about is triggers. Change your environment and it will help. What makes you think about food? If it's sitting in front of TV and just eating like me, then let's try to take care of that. If it's a certain food, don't buy that food. Just don't even bring it home. Buy smart at the grocery store. So those are definitely some things I would recommend. It is not an easy problem. There's a book called Diabetes Burnout by Bill Polanski, a great book. He's an amazing guy. I've known him for a long, and he's globally known for behavior and its impact in diabetes. So Casey, if you could give a link to his book, Diabetes Burnout by Bill Polanski. And it has a chapter specifically on food and our compulsive eating at night. So definitely look at that.
And then Kathy has another comment about highs, and then I think there's...
Yeah, I'll take care of that. Yeah. So I think the issue of pizza is very hard with insulin. So in general, because it's a mix of everything, the sugars go high a little bit later, and then they stay high for a long time. So if somebody's on a pump, they have certain ways of taking care of that. If somebody is on just mealtime insulin, it's a little bit harder. You may want to take some insulin now and some later. This is not easy. So I definitely, it's a struggle and you're saying, when should I wait till I have started eating? You could do that. You could try that and see if the timing makes a difference. In the pump setting, we use some now and some later. So pizza is a hard one. Hey, try to limit the size and that would help. All right, Kelly has a comment. I get low 3.5 hours after and have highs when I wake up. Okay, I'm going to show something like this in a minute. So thank you for all your comments. Jamie, have I missed any?
And there's one from Eugene asking about Ozempic. So he's got type 2 on metformin. Would Ozempic or something similar, like the GLP-1s that you were talking about, help control it?
Yeah, definitely. It's a great class of medication, these shots, and now they're once a week. They're pretty powerful. So I think it would be a great recommendation for you. Again, we have a trial right now for patients type 2 on metformin only, and they'll get one of these weekly shots as part of a research trial. So again, you can look at that on the website. Randy has a question. Yeah, I think this is common for us. So sitting at home during the pandemic, and this tendency to overeat and not exercise as much. So that is definitely a challenge. Of course, some medication adjustment is needed, but lifestyle, again, thinking through those triggers and then just saying, make one positive change a week or every 2 weeks. Hey, I'm going to stop eating this thing, or hey, I'm going to start exercising. So think about those.
Yeah, and we've got a challenge for you guys if you guys are thinking about doing small, simple changes. I will talk about that at the very end of this program, so stay tuned.
Excellent.
Let me talk a little bit about lows, and then we can address some more of the questions that are coming in. I'm going to be talking about lows. So as Dr. Bhargava said early on in this little talk, lowest blood sugars are technically defined as when your blood sugar is less than 70. That's going to be stage 1, but they can become more severe if you're less than 54. They're classified as more severe, and very severe if you're actually needing help. So it's happening. So Dr. B, some of the most common symptoms that patients that I hear are they're feeling dizzy, or they're confused, or they're irritated, hungry, fast heartbeat. Those are some of the more common ones that I hear about. Anything else to add on those symptoms? No,
I think people, yeah. Are you asking me?
yeah,
Or the audience? No, I think that's a great description. Sometimes people don't have symptoms and they have to rely on a sensor and things like that in advanced diabetes. But carry on. I'm enjoying the questions, but I do want to make sure we get through some of the other content, and then we'll take more questions as well.
So
So,
I
yeah.
want to go through a very similar slide that Dr. Bhargava went through, which is the common causes for low blood sugars and why they can happen. And there's many different reasons. These are going to be the main causes. And what's interesting is the first two are pretty much are similar to what causes high blood sugars. So food, not matching the food intake to the insulin that you're taking if you happen to be on mealtime insulin. So you happen to not eat as much that one day, or you thought you were going to eat more and then just got full halfway through the meal. The other thing is if you're on a medication like a sulfonylurea, which is glimepiride or glipizide, and you skip a meal, that could definitely lead to a low blood sugar if you're skipping those meals. And then if you're not, if you mismatch your medications, again, like I said, the biggest two medication classes that I'm talking to people about that cause low blood sugars are, again, those sulfonylureas and mealtime insulins. Those are the two that I counsel and educate on over and over and over. So if you're on sulfonylureas, like I said, glipizide, glimepiride, they will lead to hypoglycemia or low blood sugar if you skip a meal or if you're not careful. And then mealtime insulin like Humalog, Novolog, Apidra, those, if you skip a meal and continue to take that medicine, you will definitely put yourself at really high risk for a low blood sugar. That's something that I'm commonly counseling on. That's a big no-no.
And Jimmy, I would interject and say long-acting insulins will also cause low, especially if people don't eat, they're over basalized. So any insulin can cause a low sugar reaction.
Yeah.
Yeah.
The other things on here are going to be exercise and alcohol. So exercise is just if you're doing too much activity, and again, you maybe start on the lower side, or afterwards you continue to burn additional calories, you can potentially lead to low blood sugars. So my advice for those people who are exercising, check before you start exercising, especially if it's going to be a higher intensity or a long duration. We want you to check and make sure that it's above 90. If it's below 90, get yourself a source of snack and get it up before starting. And then again, check afterwards, especially if it's that higher intensity or that longer duration, just to make sure that you're keeping your sugars up where you need to. And then if you're going out of the house or out of somewhere where you're not near food, always have a source of sugar just in case a low blood sugar happens during a walk or during a bike ride. You always want to have that source with you. And then the last thing that's surprising to most people is alcohol, because alcohol can actually lead to low blood sugars. If you think about it, alcohol is often a sugary drink or carbohydrates. And so people are like, why can that do that? It does it because it stops your body from making additional blood sugar. So your liver makes blood sugar and alcohol stops or suppresses that reaction. And so especially if you're having more than one drink and not taking in any sort of carbohydrates with it, alcohol after a couple of hours could lead to a low blood sugar if you're not careful. So we talked through a couple of things on how you can avoid those lows, but how do you treat them? Just want to make sure we're covering how you actually treat a low blood sugar if one happens. It's going to be the rule of 15. So you're going to take in 15 grams of carbohydrates and then recheck your blood sugar in 15 minutes. So what does 15 grams of carbohydrates look like? It's going to be 3 to 4 glucose tablets that you can buy at the store. One of those glucose tablets is typically going to be 4 grams of glucose. Otherwise, you could do 4 ounces of juice, so a little baby cup of juice, or 8 ounces of milk. And I think, Dr. B, you actually taught me this when I first started working with you. Your preference is the 8 ounces of milk because it makes you feel a little bit fuller. If you do 4 ounces of juice, that's like nothing. And so you're going to feel like you're still low and you're going to want more. Whereas the milk, if you do that higher amount, you're going to feel full or feel like
Yeah.
you're satisfied a little bit.
Yeah. You know, having seen a lot of people who have lows, including one at home, it's so common to pour juice. I'm shaking full glass of juice and I don't feel better. One more, 60 grams of carb, easy. Now that's very hard to do. Can you do 60 grams with milk? It's really hard. And that's why I like milk. Plus it gives you that fullness. Plus it keeps your sugar up for a little bit longer. So let's take some questions before we move to the last thing. And we'll answer as many questions as we get. We'll stay for whatever time. So Randy, congrats. Ozempic is a great medication. Work with it, and it'll teach you, how to eat differently and so forth. It's a great medication. Big fan. All right, Jenny, I think you have a challenge, right? Husband is home, won't take care, and have desserts and so forth. And you yourself have diabetes as well. So here's the thing. One, take care of yourself. With your husband, take care of him, but the relationship as well. So again, Bill Polonsky and Dr. Steve Edelman, who do the taking control of your diabetes, they talk about this, the diabetes police, and that's the other people at home. And it's an art. It's a relationship you have to build. So yes, it will be hard many times to do this, but when he's receptive, talk about, hey, can we stop buying certain desserts? Much easier. He's not going to run to the grocery store to get the cookie he wants, right? So just at a more receptive time, try to do that. Taking control of your diabetes has some online conferences they do. Right now, they're not doing in person. Attend them. They have a session on, I think it's called the Diabetes Police. Let's see, Kathy, if alcohol can lower blood sugar, should you take insulin if you know carb count of an alcoholic drink? Okay, so one thing I want to clarify on alcohol first, it's in a sense, it gets converted to sugar. So what's the big deal about alcohol? It prevents your liver from producing sugar if you were to go low. So this is where you want to use your judgment. So let's say you had a margarita with a bunch of sugar in it, and you always go high. Take some insulin, but not the usual amount you might do with a same grams of carb with something else, because of the issue with we do not want you having lows after a drink. So just be careful. Use your past judgment on this. All right, let's move to the last topic for today. And again, great discussion today. Very, very cool. We really thrive in this. So let me share my screen and I'll run you through the last part of our conversation today. Oh, so first of all, yes, we were going to talk about time and range. So tell us, how many of you have heard this word? Tell us, are you very familiar? Maybe somewhat familiar. I've heard of it, or no idea what this thing is. So just please type in your comment. In general, it's very helpful for us to tailor our conversation. And Jamie, you can speak about those when they come in. But in the meantime, I'll move through. So in general, our life has been around A1C. What's your A1C? What's your A1C? And now A1C is a measure in your blood that gives you an average of blood glucose over 3 months. So if your A1C is 7, then your average blood sugar is around 150. And that has been our best measure for the longest time. And it still is. Your A1C is very important. But please know that that's an average. So let me talk to you about John, I used to know, the math teacher.
We got some comments.
Go ahead.
We've got a couple of people who've heard of it. Bailey says somewhat. Doug says no idea. Jean says no idea. So mostly people are not as familiar with it.
All right. Well, and I think A1C was here for 30 years, right? And still many people may not know what an A1C is. So now we're bringing a new thing. But let me explain why we are going in this direction. So John is a math teacher. He cannot swim. He is 6 feet tall, and the river is 5 feet deep on an average. You know, according to math, he should be fine. He should just walk through it. But 5 is the average. Somewhere it's 3 and somewhere 7. So John did try to walk through the river and he was never found, right? So that's the issue of averages. So we need something better. And that's where comes the time and range, which gives us a much better idea. So usually this is not with sugars, but even with sugars, we can do time and range. And on the Iowa Diabetes portal, you get that, and I can show that if people want, just let me know. But you can do time and range just with simple sugars. But in general, time and range is a concept for throughout the day, and that's done with the help of a sensor or a CGM like Dexcom or Libre or Medtronic. And you put that on every 7, 10, 14 days, and then it gives you the data and it creates this tracing. So then there are these sugars, the up and down. Usually 70 is the lower limit, 180 is the upper limit. And what percentage of the time are you in that middle of the range? That's called time in range. So it's a concept that's very powerful. There are patients like this, when the sugars are just going ups and down, the peaks and valleys. I would rather not want to be that patient. I would want to be the patient lower down. The data also gives us some numbers and it tells us the target range. And it says, hey, 47% of the time you're in target range. So this is not as good a control, right, for this person. But in general, we start getting happy with 70. If we get 80, that's amazing. And normal human beings is around 90. So just think about that. North of 70 is good in general. And as better medications come, better loops, hybrid closed loops or artificial pancreas come, I think we'll go better and better and better. But, 80% will be very satisfying.
So let me,
Sure.
We've got a question from Randy saying, do you need a CGM? And I'll add on top of that, do you need a CGM to do time and range?
Okay, so do you need a CGM? It depends on the medications you are on. In general, if somebody is on mealtime insulin, my answer is pretty much yes. Mealtime insulin, yes. Basal insulin, probably yes, but could live without it. And then oral medications in general, I'm not a huge fan unless a lot of fluctuations, then your doctor can do a professional CGM. And Jamie, your question was, can you repeat yours?
Yeah. Do you think you have to have a CGM in order to look at time and range?
No, you don't. You don't, because at our website, and I am happy to just show it. I think I have it pulled up. We'll just try to see if I can show it. Right. So inside Iowa Diabetes portal, for people who are tracking, the sugar graph shows you your range, and it talks about time and range without that. So it's a concept that can be done with sugars also. It's just that it's less information, right? So you won't get a full idea of what it is, but definitely very much possible without a sensor also. So thank you for pointing that out.
The other thing with the time and range, not on a sensor, I think if you can do the 4-point testing or 7-point testing, if you
I
want
see.
a couple of
Yeah.
weeks before a doctor's visit, that could really give the doctor a lot of information.
If you do this, your doctor will love you. So do like 4 point. What does 4 point mean, right? These are 8 points: before and after breakfast, before and after lunch, before after supper, bedtime, and during the night. If you do 4 points before the meals and bedtime, fantastic. Do it for 7 days before your doctor visit. Great, great information. A 7 point is these first seven: before and after, before after, before after, and bedtime. So these are pretty helpful, and your doctor can really give you good advice. So thank you for pointing that out. I want to go over a couple of examples of people we saw, and I just want to point out. So there's somebody who has a large breakfast or skipped insulin before breakfast. In her case, the situation was she actually forgets to take her insulin and doses it 15, 20 minutes after. And that makes it really hard. Insulin doesn't work backwards. So, how do we avoid the peaks and valleys for her? Dose the insulin 15 minutes before the meal. At lunch, she probably did the same thing, dosed it after, and then she bottomed out. Here's another example of a patient. This patient is on too much basal insulin. So these go from midnight to midnight, by the way. So what's happening is this person is low overnight, and then the body responds and they spike up. They're waking up super high. The reason they're super high is because they rebounded from a low. So again, some idea of these things, the sensors can help you in ways that sugars cannot. It's like a picture versus a video. So that's kind of a nutshell of time and range. We are getting close. Jamie, you want me to keep showing my screen for
Yeah,
this, or
you sit there, but we've got a couple of questions coming in.
okay, go ahead.
Jenny is asking about counting carbohydrates. And she says she doesn't count carbohydrates. She's got a fixed dose with a correction factor because sometimes she's over 200. She's over 200 after meals, sometimes over 300. So it sounds like every meal is not the same.
Yep.
So there's that question, and then the second question, which is
My attention span is like one question at a time. So uh, I'll just say this: you got to go for carb counting. By the way you ask your question, you get it. You know your diabetes. I think the next thing you got to do is find a dietitian who can teach you about carb counting. And we have some with us, and Mercy has some, and so forth. So find a nutritionist, CDE, and they can help you move to carb counting in consultation with your doctor. Jamie, go ahead with your second question.
the other question that Jenny had was, is it important to eat at the same time every day?
It depends. In general, I'm a big fan of rhythm biology and following the nature's things. So in general, I am. People on mealtime insulin, if they ate a little bit later, they can do it later and so forth. So people on medicines that do not cause hypoglycemia, they could skip a meal and that's okay. But if they're on medicine that cause hypoglycemia, and I won't say which one those are, you got to type in. Jamie talked about the two classes. So let's see how much we were listening. But if you're on those two classes of medications, be careful skipping your meal. So hopefully some general tips that will help you.
Yeah. And then I can pick the next one, which Jenny's asking about dosing 15 minutes before a meal for mealtime insulin. She's always done it right before.
Okay.
And it's met. So the two traditional mealtime insulins are Novolog and Humalog, and they are not quick enough in the body to take it immediately before. They take about 10 to 15 minutes to get into the body and to really start working 5 minutes even after that. So your blood sugar starts to rise 5 to 10 minutes after you eat. And so by timing the Novolog and Humalog 15 minutes before you eat, you're giving your body enough time for that insulin to get into your bloodstream, into your body, into your bloodstream, and then start working. And so that 10 to 15-minute period, if you skip that, you could actually spike your blood sugars before your insulin starts to work. There are newer insulins, Fiasp and Lumjev, that work quicker. So if you're on those insulins, you can take them right before you eat and still have a decent effect on the blood sugars.
Agreed. We're studying some insulin that have to be taken 0 to 2 minutes before the meal. That's Lumjev. We have studied a lot, and we continue to do a lot of clinical trials. So people on insulin, we have a ton of trials coming up and active now, where you get both your insulins and meters or sometimes sensors and so forth. So again, look at the website. If you don't know which study, just reach out through the website or the phone number we shared. All right. Hey, by the way, this is November. Big deal. Well, election was yesterday. That's great. Now let's focus on November is Diabetes Month, and November 14th is World Diabetes Day. So, Jamie, it seemed like you guys are up to something. Tell me more.
Yeah, we're up to something. We're doing a 7-day Facebook challenge. It's going to be led by our local dietitian, Courtney Slater. We work
Right.
with her. She's done a lot of our webinars. And it's going to be within the Iowans with Diabetes Facebook group. And what this 7-day challenge is learning to make small little changes to your eating habits that can improve your health and improve your diabetes. So our focus is changing diabetes together during Diabetes Month. Really super excited about it. And guess what day we're starting on? Click again. We're starting on World Diabetes Day. So start joining us November 14th. We'll have a sign up in about a week or so. So be looking out for that sign up. Jenny, I know that you talked with some of your frustrations with your husband. This could be one way that you both can do some steps,
Yeah.
very small steps, and interact with us. And actually, if you're interacting with us every single day for the 7 days, you automatically win a prize. And then we're giving away a grand prize also.
Excellent. So I think there were many questions about food, and this is simple, small steps help. Let's do some of those. So please join us for this. This will be exciting. Courtney is a lot of fun. We have done some webinars together, and my favorite memory is I think it was the cauliflower war. I'm pro cauliflower, and she was anti cauliflower. But finally, she decided to start eating it too. So kind of I won. But anyway, really fun. All right, Jamie, I'll just scroll through this. You tell us what this is.
Yep, we've got a courtesy care visit from last month in October. That's going to be Kathy. And Kathy, you're with us today. So reach out to us and we'll get you scheduled here so that you can see us. And then today, our diabetes detective is Kelly. Kelly, thank you for such good questions and interacting with us. We'll be reaching out to try to get you that $5 Amazon gift card. Congratulations. And then just scroll into the next one. Dr. B and I are on again in 2 weeks. We just can't get enough of you guys. So we're going to be talking all about insulin. What's new, what's coming, and then the big topic of how to lower your cost. So Iowa Diabetes is researching 2 new insulins right now, and we'll talk a little bit about that in the what's coming section.
It's crazy. Now, weekly insulins, who thought of that? And we have worked on 2 of them. Super fast acting insulin. It's crazy. So it's good stuff. We will look forward to seeing you. Before we go, are there any other questions, Jamie? I want to make sure people have joined us. If they have any comments, questions, we want to answer them.
I believe we've addressed them all, but if we've happened to miss something, we will reach out to you and make sure that we get it addressed.
Excellent. I hope this helps you. Just summarizing, peaks and valleys are a common part of diabetes. We can't eliminate them, but we can make them better. So first thing, if I have key take-home points, I'll say first, monitor your sugars. That's really the one thing, blood sugars or the sensor. Second is, focus on the reasons why you're going high or low, and focus on those common reasons and bring the sugars down. And then, if possible, get a sensor or get one of these newer medications. Jamie, what are your top 3 things you want people to remember from today?
I think my top thing is really trying to pay attention to what is causing your body to go high and what is causing your body to go low. And it's trying to keep a record of that and really paying attention. And then just knowing how to treat them when you are high or low. I just want to say thank you to everyone. You guys are all great. Doug, Jenny, thanks for joining. Jenny, first time here. Congratulations. Thanks for joining us. Tell your friends about us. I mean, we have a good following, but we want to help as many people as possible.
Excellent. We do it every 2 weeks. So we'll talk about insulins. And then we have an exciting series coming up next year for about 7 weeks in the early part of the year. So a lot of different things we're trying to do to help people, especially in this time of pandemic and can't see doctors and things like that. So join us and please spread the word and stay safe, stay healthy, and take care of yourself and each other.
Thanks,
All
guys.
right. Bye.